How is prostate cancer diagnosed? What should I expect? What is a DRE? What is a PSA? A blood test called a prostate-specific antigen, or PSA, blood test measures the level of PSA in the blood. PSA is made by the prostate. The levels of PSA in the blood are typically higher in men who have prostate cancer. PSA level can also be elevated in other conditions, such as BPH. We talked about the enlargement of the prostate, or prostatitis. Generally, the higher the PSA level in the blood, the more likely a prostate problem is present. But other factors can also affect PSA levels. Some prostate glands just make more PSA than others. Some medical procedures can affect the PSA level. Certain medications can. Enlargement of the prostate can increase the PSA level. A prostate infection or inflammation can increase it. Even riding a bicycle, where the seat of the bicycle presses up against the area where the prostate is, can elevate the PSA level. And because many factors can affect the PSA level, your doctor is the best person to interpret your PSA results. If it's abnormal, they may ask for additional testing to find out if there is a real problem. The digital rectal examination, DRE, this is a true story. We told the patient that we needed to do a digital rectal exam, and he asked, "Where's the computer?" In this case, the word digital refers to a finger. In the digital rectal examination, or DRE, a healthcare provider inserts a gloved, lubricated finger into a man's rectum to feel the back of the prostate. The back of the prostate is right up against the front of the rectum. Now, the prostate should normally feel about like the tip of your nose. It should be firm but rubbery. But if cancer is present, you may feel a hard nodule on the prostate. It may feel not like the regular tissue, or the surface may be very irregular. If the tumor is deep in the prostate, one side of the prostate may be higher than the other because the growth is forcing that side up. It used to be that these two procedures, the PSA and the DRE, were all that doctors had. Now we have new techniques available to decide whether an elevated PSA or abnormal rectal exam is actually cancer. PSA itself can be broken down to see if it's likely to be coming from a cancer. There's a free PSA and bound PSA. If the free PSA is high, it's less likely to be cancer. There are urine tests that look for signs of a tumor. Tumors have abnormal genes, that signs of which can be detected in the urine. Magnetic resonance imaging, or MRI, can take an actual 3D picture of the prostate to see if any areas look abnormal. MRI can see a tumor if it is present.